Next now is Dr. Stephen Finical, Charlotte's plastic surgeon, who is here to discuss lip injections this morning. And you were actually just telling me about some new injectables that are set to hit the market summer.
End of the summer. Vobella is the newest injection material in the United States. It was just FDA approved actually the first of this month.
Okay.
It's a hyaluronic acid filler, which means that it's reversible, and that's the good news for all consumers, is that if you don't like the result, an enzyme can be injected, it can be reversed.
That makes it much more attractive to patients.
Absolutely. The important thing about this one is it lasts for a full year. This newer one called Vobella, which means less often that you have to be injected, better durability. But the other thing, because it's going to last a long time, we're going to rely on a lot of good education to have it done right. We've all seen bad injections. Good injections, when they're done right, can be very subtle. There's essentially two things that patients want. They want definition of the lip, which we lose with aging and get those perioral wrinkles. And then also volumization. But volumization, it's not like pumping up an inner tube. It just don't plump up the whole way and make sausage lips. There's certain definition of the lips that you want to maintain when you're adding volume. So essentially,
you don't want them to look like they've been injected.
You don't want to look like sausage lips, right? The normal anatomy of the lip, there's 3 pillows on top that interdigitate with 2 pillows on the bottom and gives a nice, what we call a Cupid's bow of the lip. So we want to enhance that and not blunt that. And then the edge around the lip, as we get older, we lose it. Men have an advantage over women because of the beard. It makes the skin thicker, so we don't get a lot of those perioral wrinkles until we get very old. Yeah, we're very lucky. We got other things. But the idea with enhancing the edge of the lip really softens the beginning of those little lines and really gives better definition.
Okay, and so for patients considering getting lip injections, what makes this option more attractive than other options, say?
The most important thing about the new Vobella is it's going to last longer, meaning less often having to be injected, and the durability of that. It also has some newer technology, which means it's going to have a better kind of a one-to-one result with the shape. A hyaluronic acid, which is a natural product in our body, absorbs fluid around it. And sometimes those products that absorb more fluid will puff up over time. So you don't necessarily see the result on immediately that you'll have a week later. So this one's more controlled.
Okay, and so when can we expect to see these?
We'll expect it at the end of the summer. They're available. There are fillers available now, but by the end of summer, we're going to have this newer, longer-lasting one.
All righty. Well, thank you, Dr. Finical, for being here today.
Thank you, Emily.
And stay with us. We'll be right back.
What brand of makeup